Hello and welcome to Your Health Matters on Sun 20 TV. I'm Shari Einhorn. Today's topics are hormonal balance and women's health. We have a great show for you, so stay with us for the whole thing. Our first guest is Dr. Alex Aponte. He operates a family practice in West Hampton Beach. You practice anti-aging medicine at the Ed and Phyllis Davis Wellness Institute at Stony Brook Hospital, where you are also the medical director. So you're a busy gentleman, yes?
Yes.
So can you talk about what is anti-aging medicine and how does that relate to the clients, the patients that you see here?
I like to summarize it in, there's a cliche that says you're only as young as your oldest part. So a lot of times people will come to the doctor's office and the doctor will, check your cholesterol and do different things, but they're not aggressively looking for what will bring your demise or what will bring you suffering, perhaps 20 years away. I've been trained to try to identify that as well as to use lifestyle changes and some supplements to delay disease processes that will cause problems.
Is that a different way? I mean, it seems like it's a different way of looking at a patient because patients often go because, my finger hurts, so you're treating my finger, but you're saying you're looking for things that potentially cause problems down the road. Do a lot of doctors do that?
We're supposed to be emphasizing prevention more and more. Mm-hmm. I've emphasized prevention my entire career. It's a little bit of a different look on it, mm-hmm. in that, again, it's an aggressive look for what is the biggest threat to the person. And it's often not so easy to find.
Can you take us through how you figure that out?
A thorough history, asking you questions about what other doctor visits you've had, what other problems you've had, what your family history is extremely important, what's your lifestyle, like God forbid you're smoking. For instance, a thin Caucasian female who has no family history of heart disease, no history of cancers, no depression, anxiety, no alcoholism, no tobacco use, might have her frame or her bone density as her biggest threat. Oh. So therefore, that sometimes is an easy thing, but sometimes it's been overlooked by other doctors that may or may have seen her. And because she's young still, it might not show up on the radar as to when to check a bone density, because it's typically over 65, or if you've got other reasons to have a thin bone structure.
And so oftentimes I'm wondering how often it's really something that when you say to the patient, okay, this is what we should work on as far as prevention, where they kind of go, whoa, I never saw that coming. Like a young woman with no major health issues talking about bone density, I would imagine that's probably nothing the patient would ever have thought of.
Sometimes it is. Sometimes patients that come to Stony Brook Southampton Hospital to see me are often extremely well educated and have researched themselves quite aggressively. Other times it is a surprise that you uncover something that's potentially a danger to them.
And why would someone come to you in the first place? Specifically for prevention?
Mainly for prevention. A lot of the patients I see have symptoms still, despite seeing many other doctors and specialists. Mm-hmm. So sometimes helping somebody is outside of a prescription or a scalpel. Sometimes it's just guiding them. Sometimes somebody's got a volatile relationship in their life, and that's what's really bringing them down. So It's never a one-size-fits-all. And like I said, it's usually a pretty well-educated person. Some of the patients are against many pharmaceuticals, if not all pharmaceuticals, and I have to respect that and treat as best as I can. Sometimes I will explain in detail why I would recommend the medication based on prior experience with the situation that supplements just didn't have enough strength per se to treat the underlying cause of what's ailing them.
Is that something you're seeing more now than perhaps when you started your practice? People who are anti-pharmaceutical or less inclined to want to use pharmaceuticals? How has that changed over your years of practice?
It hasn't changed a tremendous amount. I guess it depends on what the person's looking for. Because it's a wellness institute, because we promote a lot of natural remedies, we have acupuncture, we have a nutritionist, we have massage, we have chair yoga. We have a lot of things that are outside, like a typical hospital might have, that are really helpful, that are often overlooked by regular medicine. I aggressively attack obesity. A lot of medications are used, but a lot of hints on lifestyles are also used. I don't think that there's been an uptick of patients refusing medications. There's just a lot of misinformation on some medications. There's some true information, and it's just a matter of having an honest discussion on what are the risks, what are the benefits, what are the alternatives, what happens if we don't do anything. Usually the person is glad to hear the cards are on the table and it's their decision as to where their health goes.
You made a point of saying that at the Wellness Center there are a lot of other things that are sometimes overlooked in sort of a typical hospital medical setting. Can you talk about the importance of offering all of that, all of those other therapies and other modalities to patients?
It's usually a bright welcome. One of our most successful programs is called Functional Fitness, and it kind of evolved from patients undergoing physical therapy, and although having an injury and going through that, they were, ill at the time, but they loved their physical therapist. They liked the exercise. I find it wrong to require a physician to give a prescription for physical therapy, because I feel like the physical therapists do such a great job at exercising people, keeping them mobile. You're not mobile, you're not ambulatory, you're aging in dog years, you just are not thriving. So the person loved their physical therapy and their insurance stopped paying because they used up all their benefit for that. So somebody scratched their head at the center and said, well, why don't we charge them a fee and have them come in? It won't be a private session, it'll be semi-private, but it's under the hospital umbrella where people can exercise and be guided by the physical therapy assistant as to how to use the equipment and, have an idea of what their ailment was to, address that and move on from there. And a lot of patients feel great comfort in that they've been pretty sedentary. They're trying to change their health, and they're appropriately afraid to push it because they've been told, don't do this, don't do that, or be very careful with this, be very careful with that. So they come and they can have cardiac rehab, pulmonary rehab, which are wonderful programs, and they're supervised. So it's very comforting being in a hospital. God forbid something go wrong.
Right.
You know, they're not on the track at the high school.
And you see people doing that because they like to be in that setting with other people, with also the supervision, whether it's, you know, semi-private or not, but also sort of accountability, right? If I don't feel like I'm going to do it at home on the track when nobody's making me, I'm there with people.
A lot of times it's that initial start. There's a big difference between no walking and some walking.
Right.
There's a big difference between never eating healthy and eating healthy most of the time with some bad eating on occasion. Sometimes people just need a little bit of a nudge to get them going, and then they thrive from there. Just one comment you had said about women's health. We do bioidentical hormone replacement, which means a lady goes through menopause and her hormones, mainly estrogen and progesterone, or estradiol and progesterone, have dropped. They don't drop to zero, but they've dropped quickly, and the lady has some symptoms, insomnia, night sweats, brain fog, low energy, impaired or minimal libido. All these things are part of being healthy and happy, and we can offer, with aggressive supervision, looking for the risks of hormone replacement, which are mainly breast cancer. We can offer hormone replacement.
Was there such a big focus on prevention when you first started? You said we're supposed to focus on it more now.
Being a trained family physician doctor, I have always focused on prevention because it's a lot harder to deal with a serious medical problem once it's evolved to the point of seeing it or having a consequence from it. My father passed away from lung cancer at 44. So the consequence of tobacco use is usually nothing, and then all of a sudden your whole life is turned around. On occasion, patients will come here for that, but that's rare.
Right. Okay. Dr. Aponte, thank you so much.
You're welcome.
Lots of great information. We appreciate you stopping by. We have another terrific guest right after the break, so please stay with us. Welcome back. Thanks so much for joining us. Our next guest is Margaret Iannacone, an acupuncturist at the Wellness Institute. Margaret, thanks so much for stopping by.
Thank you for having me.
So I am told you lead acupuncture circles, you do one-on-one treatments, and you teach classes at local libraries and senior centers.
That is correct. Yes.
So what is an acupuncture circle?
It is a group setting for patients where we will treat 4 to 6 patients at one time.
Oh, wow.
Currently, we do it for cancer patients at the Cancer Center here in Southampton. I believe there are future plans to expand that and include acupuncture circles for women with hormonal problems or imbalances in the future.
Can you set the scene for us about what an acupuncture circle is, and why would somebody do that as opposed to a one-on-one treatment?
We have 5, as I said, 4 to 5 people, 6 people come at one time. They usually have a common concern or a problem. Okay, I'll use the Cancer Center as an example. All right, most of these are either current cancer patients or patients in remission. All right, so they may experience the nausea, the vomiting, the headaches, the insomnia, things like that. So it simplifies the circle when we have a common strain of issues. And they will come together and they lie down on the floor, or they can bring a gravity chair, whatever their choice is, and they are treated one by one. Needles are retained for about 30 minutes in each patient. Then they are removed and the patient can leave. And that's where the circle would go. It's a simple thing. It's a group setting. The reason people would come to a group setting is again, they have common problems, so it becomes a network of people. When we worked with groups of people years ago, many of these women would come and they knew one another for years because they went through treatment together. So the circle allowed them to bond again, okay, as a group. And, you know, they form friendships and they have common issues, so it helps them. And sometimes people also, you know, there's a fear of needles with acupuncture, just the sound of it, and people freeze. This kind of helps too, because they talk a little bit before and then they can talk a little bit after, so the apprehension of the treatment is eliminated sometimes.
And can you talk a little bit about acupuncture itself? What is it, how is it done, and why people choose to do that when, as you mentioned, there is sometimes a fear of needles?
Acupuncture is actually a much larger field. It's part of traditional Chinese medicine. And traditional Chinese medicine is a lifestyle field, okay? So we treat holistically. We treat a patient not only with needles, so to speak, which would be the acupuncture, but there are about 15 different treatment protocols within the field. So we look at every part of a person's lifestyle, which is usually why they develop the illnesses or the hormonal imbalances that they do. People would come to us, and it sounds funny, but many times when they've exhausted all other avenues of treatment, they will come to an acupuncturist thinking that, well, maybe I'll just try this and hopefully this will help. They're not always ready for the fact that we will ask them what their diet is like, what their lifestyle is like, and questions that maybe they would not be asked in a doctor's office. All right.
And why do people save acupuncture for the last stop, in your experience?
I think because of the way it's been positioned within the medical community. It's been called an alternative medicine for many, many years. I don't particularly care for that term because it infers an or situation. You can either go or to Chinese medicine or to Western medicine. Whereas if you use complementary, it's a softer term. It means incorporating both medical practices. And I think it's easier for the patient then to not feel they have to make a choice between the two.
How do you integrate Western medicine with acupuncture?
It can complement. Traditional Chinese medicine, acupuncture can actually enhance the treatment from Western medicine. So someone doesn't give up their Western medical treatment because they come to an acupuncturist, or they shouldn't, let me put it that way. Okay. But it should augment what they're getting in the medical community, all right? And then acupuncture on top of that will enhance that treatment, and also it can speed recovery time, all right? In the case of surgeries and all, many times acupuncture will speed up the recovery from a surgery. If we go back to the hormonal balance question, which I believe you had asked me earlier, traditional Chinese medicine is very close to functional medicine in that they both seek to discover the root cause of an ailment. All right, it's not a superficial thing at all. It's very much deep, and that's why I say it's a commitment on a patient's part to come for acupuncture.
You're not taking a pill and hoping that your problem goes away.
We don't mitigate just the symptoms. We actually look for the cause, and that can take time. And that's where some of the commitment, and sometimes it really upends someone's lifestyle. You know, they don't realize, they think they have a healthy diet and they don't. You know, and we show them different aspects of that.
So take us through when someone comes in, maybe for the first time, for hormonal imbalance. Like, what questions do you ask, and then sort of take us through what would a treatment schedule potentially look like?
We have about 5 to 6 different diagnostic techniques that we use. We use a subjective technique where we ask the patient to share with them why did they come here for the visit today. And if it's a hormonal balance, you can go to something like menopause. Let's use that, okay, as an example. So a woman comes in and we'll ask her, you know, what are her symptoms for it? Could be night sweats, hot flashes, insomnia, any number of things. Mostly, they're all hormonal imbalances, okay? And then we'll do an objective. We'll actually watch a person. May sound strange because it doesn't happen in Western offices, but it does in a Chinese medical practice. We'll look at them. Are their eyes clear? What about their voice? Are they loud and boisterous, or are they quiet, okay? And then we'll do palpation. We'll actually feel different areas if there's tenderness or uncomfortable feeling. And tongue and pulse is the most important one for us. We look at the tongue and we feel the pulse. The tongue is a roadmap to the internal organs in Chinese medicine.
Oh, wow.
Yes.
Can you, I've never heard that before. Can you explain that?
Every area of the tongue is related to one of the meridians. Meridian is an energy path within the body. These meridians have been given Western medical names, but they're not necessarily the particular organ.
Okay.
All right, so I'll give you a very simple one. That if the tip of the tongue is red, many times that's related to the heart meridian, not the heart, but the meridian. And I can tell usually if someone has insomnia, trouble sleeping, just by seeing that.
Wow. What are some of the others?
It's a long list.
Give me one or two.
All right, if there's a very thick white coat on the top of the tongue, that means that the stomach internally is cold, a lot of dampness and cold in the stomach, usually related to a diet with cold raw foods or a lot of dairy.
Wow. Okay. And so take us through a treatment. What happens?
Well, with a treatment, once we do that diagnostic, and we are, at least in my practice, open to looking at Western diagnostic testing. So if a woman comes in and she has any kind of blood work, CPC, CMP, anything like that, we will look at it. I will anyway, okay, and just analyze that in combination with what I just took you through as far as our diagnostics. When we come up with the diagnosis based on all that information, it's nothing you've ever heard of, I can tell you that. In most of the women's cases, again, going back to the situation with menopause, many of them are related to a liver, what we call a liver energy stagnation. The liver meridian's in overwhelm and it can't relax. So a lot of women's hormonal problems will stem from that. The treatment then for that would be to reduce that energy, to bring that energy back down and balance it with the other meridians.
And how do you do that?
With needling, possibly. We don't practice the herbal medicine at the hospital, but that would be another alternative for Chinese medicine. And those where we would needle the points would be in those meridians that are either in excess, like the liver, as I just mentioned, or possibly one of the organs that is being overpowered by it. It's a strange concept, I understand.
And so take me through, you put the needles, and they're super thin, right?
The
I mean, I've
needles
seen
are-
them, I've never experienced it.
Come in someday. The needles are very thin, and they do come in different lengths. Okay, some of them are longer than others, some of them are shorter. They are inserted into points. Excuse me, there are over 360 points in the body that can be needled.
Oh.
Right? And the meridians run from, well, they run from hands to the face, from the face down to the feet, feet back to the chest. They run throughout the body like a network. And again, depending on what the diagnosis is, we will select points that would then help with this condition. This can take 3 treatments, it can take 6 treatments, it can take 6 months. It depends on how severe and how, I don't want to say damaged, but how impacted the system is.
And after treatments, if the situation has resolved itself, is acupuncture something where somebody would then come back again?
Yes.
Okay.
Yes, many times after treatment, we'll say come back in 4 to 6 weeks, depending on how you're feeling. All right, so if someone, again, going back to menopause, if someone has night sweats and they're fine, they go out, they take their number of treatments and they go out and they're fine. Then maybe in 4 to 6 weeks, they get a little bit more, it comes back a tiny bit or whatever. Again, because the body is constantly rebalancing. Mm-hmm. So that's part of why that happens.
And if someone's coming for one thing, let's say the night sweats or hormone imbalance, but you can use acupuncture for any number of ailments.
We treat everything. We treat everything from musculoskeletal to hormonal imbalance to side effects of chemotherapy, radiation. We treat it all.
Is there something that is more of a majority in your practice than something else?
I would say it's between female problems and musculoskeletal. They probably are the most.
And how do most people hear about you, your practice? Do you find it's a lot of word of mouth or?
For me, the best recommendation is word of mouth. Mm-hmm. Acupuncture, I kind of back up when someone says, oh, you know, I recommended you. I kind of shy away from that in a way because it's an individual experience. Mm-hmm. You either want to come in or you don't. And you will find that people who come in on their own volition, people who want to come for acupuncture, who feel that it will help them, they have a better success rate with the treatment. And also it's a better interaction between them and myself, as opposed to somebody who's coming because they were sort of forced to come.
What about people who are just super iffy because it's the needles? Mm-hmm. And then after meeting with you or someone else in your practice, does it ease up a little? I mean,
it depends on the level of fear. I have one patient who is just deadly afraid of needles, and I actually just do acupressure for them. Okay. Acupressure uses your fingers as opposed to the needles, and I accommodate that patient by just doing things. Acupressure is very good, actually, and I use that with a lot of patients because you can teach a patient to do it on themselves to bridge the appointments. So if they come in on a Friday, they don't want to come back till next Friday, they can actually massage some of these points themselves and help with the treatment.
Is acupressure done along the same meridians?
Same meridians, same points, yes.
Okay.
Same meridians, same points, yeah.
And when you teach patients how to do that, do you find that they do it at home?
Well, you're always going to get some that don't, but most of them are compliant because you'd be surprised how much patients want to be a part of their own health protocol. They really do. They want to know what's going on. They want to know why it's happening. And I think it helps to involve them, yes.
And do you like when patients are more involved in their care?
Absolutely, because then when it doesn't work, they understand why.
Gotcha, okay. Margaret Iannacone, thank you so much for joining us. Lots of great information and really a wealth of knowledge as far as acupuncture. We really appreciate your time.
Thank you.
Thank you so much for joining us. You're watching Your Health Matters on Sun 20 TV. I'm Sherry Einhorn. Have a great day.
Funding for Your Health Matters is provided by Stony Brook Southampton Hospital. As part of the Stony Brook Medicine Healthcare System, Stony Brook Southampton Hospital is committed to providing world-class academic-based medical care to our entire East End community.